Have you ever looked in the mirror, had a full night's sleep, and still thought, why do I look so tired? It's probably not your sleep. It might be your upper eyelids. As we age, the upper eyelid skin is one of the first areas that shows age. We can get redundant upper eyelid skin, excess skin, herniated fat, all these various things that can make us look tired and heavy and sad. This video is all about upper eyelid surgery, also called an upper blepharoplasty. I'm going to talk you through it from the anatomy to what actually happens and even see some real actual OR footage. I'm Dr. Raghu Athre. I'm a double board certified facial plastic surgeon and I specialize in facial rejuvenation. I've been doing this for almost 20 years. I do a lot of upper blepharoplasty. Upper blepharoplasty is a great standalone procedure to rejuvenate the upper third of the face and is also a workhorse procedure that we add with other procedures such as facelift surgery and the such in order to really rejuvenate the entire face. By the end of this video, you will understand everything you need to know about upper eyelid surgery, what causes the facial aging, and how we actually address the problems. So let's get started. So the upper eyelid skin basically starts from the lash line all the way to this hollow caused by the orbital rim. The skin above the orbital rim is actually the brow skin. As we age, a couple of things happen. First of all, the brows can come down. That is called browtosis and is beyond the scope of this video. However, what we're really here to talk about is the amount of redundant skin that can form of the upper eyelid skin. There are two primary things that can happen in the upper eyelid area. One, a lot of excess skin that can cause hooding, as well as some herniated fat, which can cause eyelid bags. Both of those issues are addressed in an upper eyelid blepharoplasty. So let's get down to the anatomy of this and really kind of start looking at this from a deeper perspective. So when we look at the upper eyelid, we see the upper eyelid, which is skin, and right underneath the upper eyelid, we have a muscle called the orbicularis muscle. That muscle is super thin, and you can think of that muscle kind of like a valve that goes around the eye, and that is one of the muscles that helps close the eyes. It's not the primary closer, but there is some of closing type mechanism to that muscle. Underneath that muscle is something called the orbital septum. We'll get into this a little bit more detailed down the road in this video, but behind the orbital septum lies orbital fat. All of these layers kind of act like a wall holding the layers nice and tight. As we age, some of these layers start loosening up, and as they loosen up, that fat starts to pooch out. That is the herniated fat we talk about in an upper eyelid. In the upper eyelid, there are two fat compartments, a medial fat compartment, which basically sits in the medial portion of the eye, and a medial fat compartment, which sits in the medial aspect. Both of these are normally addressed in an upper eyelid blepharoplasty. So when I see a patient for a blepharoplasty, what am I looking for? What am I looking at? Well, first of all, most of these patients that come in for surgery have very similar complaints. They complain of patients around them. They complain of people around them calling them angry or sad. They say that they look tired, and sometimes they just come in and say, listen, I've got a lot of excess skin here and it's actually hooding over and impeding some of my vision. All of these are common complaints when patients come into the office for an upper eyelid blepharoplasty consultation. When I examine the patient, this is basically what I'm looking at. The first thing I look at is what the structure of the upper eyelid looks like. Is there actually a lot of excess skin? And what is causing this excess? Sometimes, as I had mentioned previously, the brow can be falling down, which causes some degree of that excess. In those cases, the patient may need a brow lift along with an upper blepharoplasty. For the sake of this talk, let's talk about just patients with upper eyelid skin excess. Those patients have a good positioned brow and basically have excess skin of their upper eyelid. The second thing I'm looking at is their closure reflex. Are they able to close the eyelids easily? Do they have any gap on full closure? The next thing I ask patients about are dry eye symptoms and prior eyelid surgeries. It's really important to know if patients have these symptoms prior to surgery so that surgery can be tailored to be far more conservative and minimize long-term problems. Finally, I also take a look and see how much herniated fat is there or if there's any herniated fat at all. Some special instances. Asian eyelids are a special category of upper blepharoplasty. I take a look at what the canthus looks like and what the eyelid crease looks like. All of this is very important in order to achieve a very, very natural appearing upper eyelid post-operatively. So if a patient has excess upper eyelid skin and or herniated fat without brow ptosis and everything looks great, we may offer this patient an upper blepharoplasty as a potential option in their facial rejuvenation plan. Now, if we're doing just an upper blepharoplasty, almost all upper blepharoplasties are done under simple local anesthesia, meaning it can be done with just local anesthesia injected into the upper eyelid. For patients who have a lot of anxiety, we can use some sedation. However, this is rarely the case because this is a very, very insensate piece of skin. So the surgery for an upper blepharoplasty starts with marking the eyelid. The first thing I end up doing is marking the natural crease of the upper eyelid. So let's take a second and zoom right into my eyelid right here, and I am going to blink very, very slowly. You can see that there is a natural crease that forms as I slowly open my eyelid. That is called a supratarsal crease. The first thing I end up doing is marking that supratarsal crease so that we can preserve as much of a natural eyelid appearance post-operatively as possible. Once I've marked out the supratarsal crease, the next thing I do is have the patient smile and look where the natural lines of the eyelid are. This allows us to fit the incision in one of those lines further, making the eyelid surgery almost invisible after surgery. Once this is done, the next order of business is to measure how much excess skin I have. So one of the things that I end up doing is first of all have the patient sit up just like this and blink and close and mark the amount of excess skin. In the operating room, I then take some forceps to measure that piece of skin again and make sure I am not opening the eyelid too much if I resect that amount of skin. Once that entire area is marked out, the next thing that I do is numb the area with some lidocaine. That's performed with a bunch of small injections which basically make the upper eyelid completely numb. Once the lidocaine has been injected, I allow the patient to wait for about 5 to 10 minutes to really allow the anesthesia medicines to really set up. Once that's done, the first order of business is to take a scalpel and trace out that incision that we marked out earlier. The skin is then elevated from the underlying orbicularis muscle and the skin is removed. We're looking at a nice thin sheet of orbicularis muscle. The next thing I do is cauterize a very, very thin strip of orbicularis muscle right underneath where the supratarsal crease used to be. I take a thin strip of this muscle out, which further sharpens the supratarsal crease. What lies underneath the orbicularis muscle is the orbital septum. I make a small incision in the middle portion of the orbital septum and remove the fat that pooches out. That same process is done over the medial portion of the eyelid. This is very, very important. I leave bridges of intact orbital septum and only make very small puncture incisions in the septum to remove the fat. This leaves most of the natural structures of the orbital septum and of the eyelid completely intact. This allows patients to recover quicker, with less bruising and swelling. Once the fat has been safely removed and cauterized, the last order of business is to close the skin. I close the skin with a very fine suture that is run underneath the skin. Those sutures stay in place for about 5 days and then are removed in clinic. Most of my patients are able to return to work the same day as having upper blepharoplasty surgery. It really is a very painless and easy recovery procedure and allows patients a fantastic ability to rejuvenate the upper 1/3 of the face with very little downtime, very little pain, and very little total effort on the part of the patient. It really is a very high return on investment type procedure. I actually did an upper blepharoplasty on my patient coordinator in the morning, and she was back seeing patients the same afternoon. The entire procedure takes about 1 hour from start to finish. I really hope this video has been useful if you're contemplating things like how to rejuvenate the upper third of your face, or you feel like you just look tired all the time despite a full night's rest. If you have any questions about upper blepharoplasty or rejuvenation, please give us a shout. I hope you really enjoyed the video. Till next time, Dr. Raghu Athre, Athre Facial Plastics, Houston, Texas. Till next time.